about?
It's actually great that we are talking about this one because it affects a lot of women. And not only does it affect women or rather pregnant women, it affects, you know, people who have had children essentially. So men can be diagnosed with postpartum depression. People who have, adopted children, surrogate mothers can be diagnosed with postpartum depression. So it's much more common than we think. And the reason I think it's so important that we talk about it is the impact that it has. So you mentioned baby blues and you mentioned postpartum depression. There is a difference between the two, but I'll start by defining what postpartum depression is.
Yeah.
So essentially, it's depression, exactly the same symptoms. Um, Depressed mood, lack of interest, low self-esteem, feelings of hopelessness, feeling worthless, suicidal ideation, um, low appetite, increased sleeping patterns. Exactly the same diagnostic criteria that is used to diagnose depression. The only significant difference is that it happens during pregnancy or within the first 6 weeks of delivery. So someone who presents 10 weeks after they've delivered cannot be diagnosed with postpartum depression. They may present with
Somebody
the
who
same
presents
symptoms,
with
but
what?
somebody who presents with the same symptoms
Uh
but
huh.
10 weeks after delivery cannot be diagnosed with
Oh,
postpartum depression.
so,
That person then has depression,
oh,
just
okay.
like you and I.
Yeah.
So the significance about postpartum depression is that it must have started within pregnancy or within 6 weeks of delivering. Now, obviously, for adoptive parents and men, it's a little bit different. And I won't go into those details, but fundamentally, that's what postpartum depression is. And like I've said, um, it's exactly the same symptoms as a major depressive episode that we diagnose in a non-pregnant population. Um, the difference with baby blues is that baby blues is, I suppose, if I can put it in simple terms, it's feeling, it's feeling it's feeling labor, like, so you get bouts of crying, you're quite sad, you're quite anxious post delivery, and it's for usually about 1 to 2 weeks, and this baby blues, it usually resolves. It's not as serious as postpartum depression. It's not accompanied by those other symptoms, and it doesn't impair your ability to function as depression does. So that's what baby blues are versus postpartum depression.
Oh, all right. So, what factors increase one's risk of having postpartum depression? Like, who is more at risk of having this?
Okay. So, people who are at risk. So, one, if you had postpartum depression in a previous pregnancy as a woman, your chances of getting postpartum depression in subsequent pregnancies increases by 30%. That's quite significant. Yes? So, one is having a history of postpartum depression in a previous pregnancy. It's having a history of mental illness yourself. So, it can be anxiety, it could be it could be anxiety, it could be substance use disorder, any
Okay.
other history of mental illness with yourself and in your family. Also increases the risk of developing postpartum depression. Another thing that makes women particularly at risk of having postpartum depression is something that we call premenstrual dysmorphic disorder,
Yeah.
and this is a mood disorder that happens around our menstrual cycle. As I've said, it's a disorder, so it is also, you have to present with a set number of symptoms, and it must impair your function, and it must cause significant distress. So women who have that premenstrual dysmorphic disorder are at higher risk of developing post-menstrual uh, postpartum depression. And then things such as having very limited support makes women vulnerable. so it also increases the risk of developing postpartum depression. If you are having interpersonal relationship conflict, so conflict within your marriage or conflict within your relationship with your partner while you're pregnant or while you're dealing with the pregnancy or after delivery, that makes women particularly at risk also of developing postpartum depression. And then also when you are having, people fall pregnant, and sometimes the pregnancies are not planned, sometimes the pregnancies are not wanted. So dealing with those emotions around the pregnancy itself can also make women at risk of developing postpartum depression, especially if the pregnancy invokes negative feelings as opposed to positive, feelings that you welcome. And then being a younger mom, so teenage moms tend to be at higher risk. And like I've said, people who don't have support, single moms tend to be at higher risk. Um, yeah, and then also has a child who I can say has special needs, or let me rather say the having to deal with difficult circumstances after the delivery also tends to make women be at higher risk of developing postpartum depression.
Yeah.
Sorry, the thing I forgot to mention
Yeah.
when we were talking about definitions is that it can present as depression, but it can also present as psychosis. So perceptual disturbances, hallucinations, you're hearing voices, you're hearing voices, you're seeing things that are not there, and you have delusions. So that's also another way in which postpartum depression can present.
All right. Sure. So is it possible to prevent it?
So it's not necessarily possible to prevent it,
Mm.
but what I can say is that it's important for us to know what the it's important for us to identify the red flags as early as possible so that we can intervene as early as possible. And the interventions can be, through support, and sometimes, unfortunately, sometimes you may need, um, um, uh, you know, intervention in terms of therapy or even medication. So, we can't necessarily prevent it, but we can definitely intervene so that it doesn't get to a severe point. Um, yeah, so I think, the thing I want to say, we should look out for the red flags. Look, pregnancy is a state that changes everything. It changes your hormones, it changes your emotions, it changes your body physically. And so I'm not talking about those kinds of changes. We expect those kinds of changes. We expect women to be, more emotional. We expect them to, deal with stresses differently during pregnancies. That is not what I'm talking about. I'm talking about the extremes where you have a depressed mood, you
Yeah.
are, unable to function. So those are the red flags that we need to look out for. And also the other really, really important one is fear of thinking that you are going to harm your child. That's another one that comes out as a very strong red flag when we're dealing with postpartum depression. And it makes women feel guilty. It makes women and parents feel guilty, and it makes them not want to seek help. But what I want to say is that postpartum depression is very common. You're not alone. But it's important to identify those red flags and go for help, if you are experiencing any of those symptoms.
Sure. But now we're mentioning new parents, and I'm asking
Yes.
myself, can a man have postpartum depression together with his wife, or is it that because the wife has postpartum depression, then it affects the man as well? So we say new parents affected by postpartum depression, or are they
Yeah,
both? Can they
yeah,
both be diagnosed with it?
so we know that in medical terms, postpartum the word in itself requires you to have been pregnant. But in psychiatry and psychological terms, because we know sort of what contributes or, you know, sort of the risk factors that can lead to postpartum depression. New parents, so a man or a husband, a partner, adoptive parents, even surrogate mothers. You know, as a surrogate mother, you carry a pregnancy to term, and then you give the child to, the parents. Any of those people are at risk of developing postpartum depression, but that postpartum is in inverted commas because they were not pregnant themselves,
Yeah.
but they have been exposed to an environment where there's a new child, and all those stresses and those emotional changes and all those factors are still present in those circumstances as well. So in the sense, we can say they can have postpartum depression in inverted commas. So the precipitating
I hear
factor
you.
is being a new parent.
I hear you. Now, how long does it take? Can it last for like a year in one's life?
So, yeah, that one is a bit of a tricky one for me to answer. So the thing about postpartum depression is that if it's diagnosed within pregnancy, like it's like hypertension. It's like having diabetes. It's possible for you to recover from it, but it's also possible for you to have it, for life. But after a certain period of time, like I've said, we diagnose it within 6 weeks of pregnancy.
Yes.
So if let's say, sorry, 6 weeks of delivery. So between you falling pregnant and after 6 weeks of delivery, once you have that, you will sort of be labeled as someone who has postpartum depression, and that will stick with you for life. But that postpartum tends to fall away, just in the way that you speak. It tends to fall away maybe a year after, and then we'll just say that you have depression, but we know that it started in the postpartum period.
Oh, yes.
So, yes, but it's possible to recover from postpartum depression
Okay.
with adequate support, adequate therapy, psychological therapy, counseling, as well as medication. Often women sometimes have to go onto antidepressants, anti-anxiety medication. Yeah, but it is possible to recover from it, but it can also, you can live with it for the rest of your life.
How does it affect the baby? Can the child
Yes,
feel rejected and not loved by the mom?
I love that question because that's one of the, very difficult women and new parents find it's difficult to deal with. And if there are other children in the house,
Yeah.
when there is a new child, it also affects them. So, a child, they don't know what's going on. But what does happen is that it affects infant mother bonding very, very significantly. It affects the infant mother bonding. It affects the breastfeeding, uh, and that's because of that infant mother bonding. So women tend to feel that, they can't breastfeed at all. And then it can also precipitate sort of negative parenting practices. So it can also precipitate negative parenting practices, and then it can affect the relationship between the parents, affect the relationship between the parents and other children in the house if there are other children in the house. And we also know in a study that was done in America that children who grow up with a parent that have a mental illness have something that is called an adverse childhood experience, and that later in adulthood, can contribute to them developing their own mental illness or significant, stresses in life later in childhood or even in adulthood. So it can have a very, very big impact, especially when that mental illness is undiagnosed and the mental illness is not treated. Remember, mental illness exists on the spectrum. So you can have postpartum depression that's mild, your symptoms are impacting you, but not significantly. And you can be on the polar end of the spectrum where you're having suicidal thoughts, you having thoughts of wanting to harm the child. It's very, 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 very distressing. And those two things both, can exist, and we need to be aware of it.
All right.
And they impact the family as well.
All right. Let's just take a break and then let's come back to sum up with Dr. Inga Mgalile. We're talking postpartum depression.
Met die afsterwe van 'n geliefde moet 'n mens te midde van die hartseer ook nog 'n begrafnis laat realiseer. By Martins begrafnisdienste in Voortrekkerstraat 38 Benoni staan Gerard of Marlien de Bond jou by om 'n begrafnis bekostigbaar te hou. Kontak hulle gerus by Johannesburg 422 5224 of alle ure by Johannesburg 744 0155.
Exciting news, calling all students and travellers. Hop on our new routes. Travel now from Pretoria to Port Elizabeth or back via Fort Beaufort. Our popular stops include Johannesburg, Potchefstroom, Klerksdorp, Welkom, Bloemfontein, Queenstown, Fort Beaufort and Grahamstown. Contact us now on 021 380 4400. Chat with us on WhatsApp, Twitter or at intercape.co.za. You could also book your ticket at any one of our offices countrywide. Intercape, safe, dependable, affordable.
Matlafala moyeng ka go theeletša lenaneo la rena la Hlalanathi la bobedi le la botlhano ka iri ya robedi thapama. Theeletša baruti ka mehutahuta ge ba ruta lentšu la Modimo go tiišetša tshepo pelong ya gago. Theeletša Radio Pulpit mo go 657 AM go agega moyeng.
Join Dwayne van Rensburg in the program Filling the Gap every Monday night at 7, where we aim to bridge the gap between young and old by promoting dialogue. Let's talk about the issues that matter in Filling the Gap on Radio Pulpit 657 AM.
You're on 657 AM Radio Pulpit, your daily companion. I'm Mgalile Mofokeng with you up until 11 o'clock. At 11 o'clock, Germany, Yannick Belser comes through with Perspective. And right now I am with Dr. Inga Mgalile, and we're talking postpartum depression. Doctor, before I come back to you, let me greet Frank Jacobs. Let me acknowledge Frank Jacobs and Tulani Ndlovu. Wow, today you are coming via our Facebook. That is so awesome. Thank you so much, family, for tuning in. I would have loved, let me open the lines. If you have something to ask Dr. Mgalile, let me open the lines for you to can ask your questions. Maybe you have a loved one who's going through what we're talking about, or you yourself are going through it and you need to ask some questions. And the lines are opened on 012-334-1322. It's 012-334-1322. Alternatively, you can send us a WhatsApp on 082-657-272-908 2-657-272-937-871 is our SMS line. Okay, 37871 is our SMS line. Hello to Jean and hello to Pietro Small. Morning. Megweningen. Thank you so much for joining in. So if let me ask about somebody who is diagnosed with postpartum depression. How can we then help this person, because they're going through a lot? It might be hormonal. Sometimes they're crying, sometimes they feel all of these emotions that are there. But how do we support them as their loved ones? Because sometimes we don't really know how to support them. I've seen in our black cultures or in our black families sometimes the old gogos who are not clued up about what's happening, they might feel like uyatefa. I don't know what is khotefa in English. I'm trying to get the right word. But they think this person is impossible. Breastfeed your child. And so you might be scolded for it, but you're not, it's not intentional. You're not doing it intentionally. So how do we support them when we realize that, this is what's happening to this mom who just gave birth? What do we do to support?
No, you're absolutely right. So, there's still a lot of lack of education around postpartum depression, and there's also a lot of stigma that's attached to depression on its own that is even worse when it's postpartum depression. It almost creates this sense of how could you feel that way towards your child. even though that's not what it is. Or how could your child make you feel this way? And that's not even what it is. But yeah, so I think the first thing is for us to acknowledge it, to say, you know what, this is something that your loved one is going through. It's not their fault. It's out of their control also. And they need people around them who are understanding and who are going to support them. And then the second thing I would say is that, it depends on the circumstances. If you're having somebody who has mild postpartum depression, they may still be able to function. They may still be able to look after the new baby, because also remember there's a new baby in the house. They may still be able to look after the new baby, but may need additional, support and, more people hands-on assisting them. We'd say that it takes a village, and, these days it feels like we're losing that practice, but really, these new mothers, that's the kind of support that they need. And when you have someone who's on the opposite end of the spectrum, they may need somebody else, to take over the parenting completely. Sometimes these moms and these parents need hospitalization as part of their treatment.
Okay.
And obviously in that instance, the mom is removed from the parenting. So that you may need a whole additional other person to assist with parenting. So it's also about the language that you use around mental illness and mental, and postpartum depression. We need to not victimize. We need to not shame. We need to not enforce feelings of guilt in the way that we speak. So, you were speaking about uktefa. When you say that to somebody who's wild, they won't care. But if you say that to a mom who's, struggling with postpartum depression, they will feel
It's a wound.
that you are, you are rubbing salt in a wound. So, yeah, I think that's the advice that I have.
All right. A family member says, Mgalile, please ask a doctor if diet can also help.
Yeah, so diet can help, exercise can help, sleeping can help, just, if I can say, leading a healthy lifestyle in general, that
Oh, Dr. Mgalile?
does help. Yes, it does wonders for your mental health, even when you are not suffering from mental illness.
Okay, I think we
For
are.
somebody who's using me,
Yeah.
I'll say, leading a healthy lifestyle, which includes eating well, sleeping well, exercising, resting your mind, practicing mindfulness. All those things are great, just in general for mental health.
All right.
But for people who have mental illness, it helps them it helps them significantly. I once had a conversation with someone. I was visiting a GP, and she was also seeing her GP. And she was telling me she's so sad.
Oh, my. Dr. Mgalile.
These trials, lifestyle changes, and they were working, and they're not working anymore. So I'm just sharing that very short story to say that it can make a significant difference. Those small things that you can do, they seem insignificant, but they make a very big difference.
All right. Mgalile and Dr. Mgalile, thank you for the topic. Can a child who has separation anxiety also cause their mom to have postpartum depression?
So like I've said, anything around the pregnancy and within those first 6 weeks that can, cause the new mom or the new parent to have just like any kind of distress, that can precipitate a postpartum depression. I don't know if the separation anxiety is this in a child that's already.
Yeah, I think the child, because she's asking about the child who has the separation anxiety. You know those babies that you can't put down?
Yeah. So,
when they are on you, they can sleep and everything. And when you try to put them down, so you're never getting a rest.
No, so I would say that yes and no, in the sense that you need to be at risk of developing postpartum depression already for a child who has to precipitate it.
For a
if that
child?
makes sense. For a child who's difficult, I'm saying so the child is crying, you can't put the child down.
Uh,
Some moms, are dealing with children who have special needs. So you
yes.
need to be at risk already. You need to already be at risk, and then that can further, that can further make you more at risk of developing postpartum depression, or it can trigger you for even more.
Okay, all right. It can trigger you even more. So, a family member wants to understand the difference between postpartum and postnatal depression.
Yeah, so it's the same thing. It's you can use it interchangeably. In fact, when I was doing my research, I saw that the world of psychiatry is looking to not replace, but I suppose modify the specifier
Okay.
to say perinatal, for it to sort of be around the perinatal period, because that is what postpartum depression actually is. The word is a misnomer because it suggests that it only happens after pregnancy, but actually the diagnosis is made during pregnancy and within those 6 weeks post-delivery. And so they sort of want to move away from the use of postpartum to perinatal,
All right.
which is around the pregnancy.
All right. So, some words to our families that are pregnant now, how we can support, and even after the one who might be feeling the blues, sadness, and all that after giving birth. What are the advices that we have for them?
Yeah, so my advice is let's create a safe space, so that pregnant moms or expecting parents can, voice that they difficulty, voice that they are struggling. Um, let's ensure that they know that they're not alone. We're here to support them. We are holding their hands, and also, that if that postpartum depression or mental illness, in fact, is normal, especially in pregnancy. The pregnancy stage itself can precipitate and trigger that, and that they're not alone, and yeah, it's not their fault. It's not their fault. It's them doing whatever they're feeling. It's not their fault, and that for us to be encouraging for them to seek help. If they need someone to go with them, you go with them. Just hold their hand, basically.
Just hold their hand. I'm thinking about those moms before we close, Dr. Mgalile, that you see on your TikTok, that you see on, let me say, on social media platforms, who would show you a beautiful picture, and they say the what you see on TikTok or what you see on Facebook or wherever, and then
Mm-hmm.
another picture, or like a beautiful picture of them holding their baby, kissing their baby,
Yeah.
excited, and then they show, and then they say the reality, and then you see they are crying uncontrollably, trying to
Mm.
breastfeed the child, wouldn't okay, wouldn't that create more problems when
No, so I think representation matters in in any sphere of life. So I think when people hear other people sharing their stories, it makes them feel that they are not alone. It's different when someone is going through something and other people who are not going through that thing are the one providing the support. Yes, they'll appreciate the support, they'll love it, but it's different when you see someone, especially when it's someone who is, who has influence, and they are talking about the exact same experience you are going through. It makes you feel seen, it validates your experience, and it sort
but the
of
one who's
gives it.
exposing themselves to social media and going through that, wouldn't it create, because on social media you don't only meet the supporters who will
That's
say,
true.
oh, we hugging you, whatever, but you will find even evil there
Yeah, that's
that
true.
can
That's
also, yeah,
true.
so wouldn't exposing yourself to such when you're going through that period also expose you to harm?
Yes, it will expose you to harm. As social media, on a normal day to day basis, you can be exposed to harm. And I think instances, you should use your discretion. Of course, with somebody who's experiencing severe postpartum depression or any severe form of mental illness, my advice would, be like, don't engage in that kind of content on social media, because it precipitates and it triggers you. And that can happen even when you're having mild symptoms. So I think there it's about using your discretion.
Okay.
It's about filtering responses, filtering what you see, filtering what you engage with. But certainly it can trigger you.
Why do we see a lot of our rising where postpartum is concerned? Why is it such that we have a high rate now of women experiencing this? Is it the kind of lifestyle that we are living now, the fast one, pressures of life?
So I wouldn't say necessarily that we are seeing. I mean, the numbers are higher than they were, but the numbers have always been, postpartum has always been common. I think the difference is now that people are speaking out about it, and so it seems like there are more numbers, because now you see a lot of people they're talking about it. You see someone, they'll share a testimony on Facebook, or someone will share an Instagram post, or someone will on a blog. So it's something that people are speaking about more openly and more commonly, and I think it creates the impression that it is more common. Whereas it has always been common, but people were suffering in silence before.
All right. Dr. Mgalile, thank you so much for talking to us about this morning, and I hope that we were able to can assist and help the family out, and maybe they will also go out seek help, or now they will support their loved one much better, or they will get help, and maybe one of them even needs what did you say again? They need to be admitted at the hospital, and maybe that's what they need right now, to be separated from the family so that they can get the best help right now. So thank you so much. But for family members who still want to ask questions on this, want clarity on this, how can they get hold of Kiredi to get more help and clarity?
Yeah, so you can chat to us on our website, any of the doctors there, on 060-010000, and we also on all the social media platforms at Kiredi SA, so Facebook, Instagram, X, we also on TikTok, and then any of our mobile clinics, and you can check on our website to see where your nearest mobile clinic is.
All righty then. Thank you so much for talking to us. Have a blessed Wednesday further.
Thank you so much. Goodbye.
Bye, Dr. Mgalile. And yes, family, you can visit their WhatsApp number to find out about the Kiredi Mobile Clinic at your area, or if you want to know where they are at in your area, you can go to their WhatsApp number 060 0190000. So our regular live conversations with our young doctors are hosted, and you can reach out to them with thoughts, questions, or concerns on social media handle at Kiredi SA on Facebook, Instagram, Twitter, and TikTok. Speak to a young doctor and ask questions by sending hi to their WhatsApp number 060, let me say it correctly, 060 019 0000. It's 060 019 0000.